Right. What we're going to talk about in today's conversation is what to expect after a total hip replacement. Now, people ask, when am I healed from a hip replacement? And it occurs in stages. That's the best way to understand the recovery process. Now, after you've spent a night in the hospital or gone home, what is the recovery process like from there? You're going to get up and walk the same day of the surgery. That is an important thing because I want you to really feel comfortable and confident with your new hip. Physical therapy is going to start the day of surgery, and then you're going to do about 3 sessions a week for a month or 6 weeks, depending on how fast you progress. The other thing that's important to talk about is the importance of physical therapy. When I do the surgery, I'm removing all the arthritis from your hip. But over the past few years, as the arthritis has set in, the surrounding soft tissue, that's the muscle and the ligaments and the tendons around that hip, have gotten really tight because you've become stiff in that joint. And that just takes time to open up and to mobilize. You know, there's so many patients that come in and say, I can't tie my shoes, it's really frustrating. We'll get you there, but that actually doesn't happen right away. That takes work with therapy to get you to where you want to be. Another important thing to think about in the recovery process are the medications that you're going to be taking. You're going to be taking aspirin or sometimes a stronger blood thinner after the surgery in order to prevent blood clot. Another medication or series of medications that you're going to be taking are to control the pain after surgery. Patients still do take oxycodone, which is a narcotic. Almost everybody is off that pain medication by 2 weeks after surgery, which is terrific. The other thing that we've really started doing effectively is adding other medications, non-narcotic medications after surgery in order to prevent an over-reliance on like the oxycodone. And then I'm sure you've heard me say this in the office, and I'm going to say it again on video, is that icing makes a world of difference. Especially in the first 2 weeks, I want you icing basically as much as you can. Now let's talk about mobility after the surgery. I do an anterior hip replacement, so I don't want you worrying about hip precautions. You can bend past 90 degrees. You can internally, externally rotate your leg as you want. You do not need to put a pillow between your legs. If you're comfortable sleeping with a pillow between your legs, that's fine. But you don't need to worry about the hip popping out. You're going to use a walker for a day or 2 after the surgery. Sometimes people need it up to 2 or 3 weeks. But people, I think in general, transition very quickly from a walker to a cane. And then they go from a cane to walking independently somewhere between 2 to 4 weeks. Slow and steady wins the race when we're talking about mobility after a hip replacement. I actually have to tell people to slow down more than I have to encourage them to do more with therapy. And the last thing is what to expect in terms of follow-up visits. I like to schedule a 2-week visit after the surgery, a 6-week visit after the surgery, and a 12-week visit. If you have issues at any time between then, you obviously can come see me anytime.